Namibia has come a long way in fighting against HIV and AIDS and has improved the quality of HIV prevention services. The country is gradually on a route to battle the HIV and AIDS epidemic.
The latest estimates from the Ministry of Health and Social Services show that 86% of persons living with HIV aged 15 to 64 years know their HIV status. And of these, 96 are on ART, and 91.3 of these are virally suppressed and no longer spread HIV.
HIV treatments and care services, which include testing, prevention, PEP, PrEP, VMMC, and treatment, are accessible at all health facilities countrywide. Deputy Minister of Health and Social Services, Dr. Ushua Muinyangwe, says people need to be reminded that antiretroviral medicines do not cure HIV infections or remove the virus from the body, but they can stop the virus from multiplying.
The U=U sensitization campaign is intended for all adolescents and young people, those living with HIV and those that are HIV negative. If adolescents and young people living with HIV know their viral load is suppressed and that they cannot transmit the virus through sex, then they will be encouraged to remain on treatment.
In many communities, many young people with HIV and who are on treatment have discontinued their medication due to stigma and discrimination. Behavior change is still key in the fight against HIV and AIDS.
Young people living with HIV and children infected at birth continue to suffer stigma and discrimination at the hands of their own families, communities, and also schools. And I think those of us who live with HIV can testify to that.
The Be Free campaign, alongside the Ombesha Yehinga organization and Young Empowerment Group, have implemented their strategic approach on interventions to lessen the HIV and AIDS epidemic.
Every conversation that we have has HIV components in it. For example, gender-based violence and HIV. There's a rape component. When it comes to teenage pregnancy and HIV, it's unsafe sex. There is HIV and mental health. Mental health usually leads to suicide. Some people aren't counseled enough after they receive their status, so they don't know what to do, they don't know how to act.
The two-day conference that brought together youth organizations will generate momentum to ensure that their voices are heard and build on innovative thinking solutions for the promotion of the U=U campaign. Vanessa Njitaviwa, NBC News, Windhoek.